Welcome, everyone. Thank you for being here in our second webinar in the Developmental Screening Summer Series. My name is Julie Emery, and I'm the Pediatric Medical Home Coordinator for the Bureau of Family Health. Before I introduce our speaker today, a few housekeeping statements. For accreditation, this activity has been planned and implemented in accordance with the accreditation requirements and policies of TMA through the joint providership of Louisiana AAP and Louisiana Department of Health. The Louisiana AAP is accredited by TMA to provide continuing medical education for physicians. Louisiana AAP designates this live and enduring activity for a maximum of 0.5 Category 1 credit. Physicians should claim only the credit with the extent of their participation in the activity. You can find out additional information if needed by contacting CME at laaap.org. Also, for our disclosure, Valencia Wallace has disclosed that she has no relevant financial relationships. All remaining faculty, Louisiana AAP, education community members, and staff have no relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. So to receive credit for the webinar today, please complete the evaluation, and that will be placed in the chat at the end of this session. Now, today I have the pleasure of introducing our speaker, Valencia Griffin Wallace, a valued family leader with Project SOAR, which stands for Screen Often and Accurately Refer. Before we hear from Valencia, I'd like to level set with a few findings from the 2024 Project SOAR surveys, which included 718 caregivers and 53 providers across the state. The survey confirmed that families value and trust their pediatric providers and are actively participating in discussions about their child's development. However, at the same time, many families report leaving visits without a clear understanding of what was screened, what the results mean, or what steps should follow when concerns are identified. These findings are especially important as research shows that screening alone does not improve health outcomes. Screenings must be accompanied by effective referrals, care navigation, and support that help families successfully connect to services. The data highlights opportunities to strengthen how screening results are communicated and how families are ultimately connected to the care and resources they need. So, to help us better understand this experience from the family perspective, it is my pleasure to introduce Valencia. She is an award-winning author, speaker, and advocate whose work is rooted in the belief that every person's story deserves to be heard. She's a Louisiana native. She is a former court-appointed special advocate, or CASA. She's a former foster parent and an adoptive parent who draws on lived experience to inspire meaningful conversation. Whether writing or speaking, Valencia encourages audience to see beyond assumptions and recognize the power of perspective. And today I'm thrilled that she will be sharing her perspective as a family leader and offer insights into what it takes to build a system that families not only access but truly understand and trust. So please join me as I turn it over and welcome Valencia.
Awesome. Thank you. I'm very excited and a little nervous to be here, but hopefully this will help close the communication gap. So to start, I'm not a clinician, not a provider. I'm not even a policy expert. I'm just a parent. And that says a lot. So everything I share today is from not only my experience, but the experience that I've collected being a CASA and foster parent and advocating for families in Louisiana. So hopefully this will give you something that you could carry back into your practice in your lives. So to start, why does this even matter? How something is communicated matters just as much, if not more, than what is communicated. So, whether a family feels like a partner or a passenger when it comes to their care makes the difference. It shapes trust before you even give a single diagnosis. And that's very important. We have to think about the message and the messenger. And that's just not my opinion. If you look into Healthy People 2030, they're tracking that. And one of the goals are, let's increase the number of adults who provider checks to see, did you understand what I just told you? So they want to decrease the number of adults who report poor communication with their provider. And they want to increase the number of adults who felt involved. That goes back to that passenger or a partner when it comes to their decisions about care. That's basically today's whole presentation in one extra long run on sentence. What we're really going to unpack today is that gap and how we could close it in the 15, 20 minutes that you may have to see families. So Julie kind of touched on me being a biological parent. I was a foster parent for many years, and now I'm an adoptive parent. And it's just not those different parenting titles, but we're talking about age and understanding. So that means that I've sat in plenty of chairs in the system, various appointments, various insurances, various knowledge across many different seasons from 20 to now 49. So we're not only talking about changes in healthcare, we're talking about changes as a parent and my understanding. So the short version of what that taught me, when I'm walking into the room dealing with different providers, my understanding is different versus then. I'm not scared to ask questions anymore. As a young parent, we often have fewer resources. And again, the knowledge, the wisdom gap, the experience gap is there. Now I'm an older parent, so I'll walk in with questions. I will message my doctor. But those things, again, comes with time and my comfortability with the provider. So one specific example I'd like to give so you can see what it looks like when it's working. Not long ago, my twins got a new pediatrician when their older pediatrician retired. And so I'm already coming in a little apprehensive because I've been dealing with this one pediatrician throughout my CASA experience, my foster parent experience, and now all of a sudden I have a new pediatrician. Now, most of us in Louisiana do have seasonal allergies, and my kids are no different. One day, one of the twins woke up and her face was so swollen, it looked like she ran into a wall. And I contacted the pediatrician, but because she knew my girls had seasonal allergies, She understood and communicated with me as a parent, not just someone being paranoid because my child's face is swollen. So I was able to just send pictures. She gave me a plan of action to follow, all without me having to go into her office. And as busy people today, those things are very valuable. I felt valued. I felt like a partner in my kids' care versus you don't know what you're doing, bring her in. But that's not necessarily what really made the difference. She called me later that day to check on my child. And I know she probably saw a million patients that day, but she took the time to say, hey, how's she feeling, how everything is going. That's that communication as parents that we long for. That's something that I value as a caregiver. And she trusted me that I was going to follow through with what she said. So when we think about different experiences that shape care, those are things patients notice. And it may have taken her all of 2 seconds, but now I'm not necessarily looking at her like the girl's new pediatrician. So we were starting to build that relationship all based off how she's communicating with me, and I don't feel like a number or an aggravating parent. So some of the things patients notice besides that, they notice if they're being interrupted or spoken over. We notice assumptions, whether a doctor or provider trusts you, what I'm sorry, whether a parent will understand or follow through. So you could sometimes assume, well, they're not listening. The parent's not listening. Body language and tone, those things communicate how you trust me as a parent. Is a concern being brushed off a little too quick? Yes, it was seasonal allergies. Been dealing with it for a while, but I'm still concerned. And medical jargon. I often say sometimes we use a $20 word when a $5 word will do. You, as providers and professionals, have all the jargon and different terms that make sense to you, or maybe the coder that's doing the medical coding. But as a parent, we don't always know. And a lot of times we may not ask, hey, what does that mean? So another thing, talking with a family instead of at them. So all of that kind of goes together. Are you talking to me? Are we partners? Or am I a passenger in my child's care? Sometimes you're going to have to use different tones with different patients. Who you talk to, when you talk to a younger parent, like I said, it's the wisdom knowledge gap versus an older parent. The tone may be different, but as parents, we notice that. Are you talking to me like an adult, or how's that going? So the same instruction can come out warm and good with one family and then hurried with another. Again, families notice that, caregivers notice that, patients, parents, we notice that. So it's the message versus the messenger problem. The message could be exactly right and still land wrong because of the delivery. We notice the tone, the pacing, the body language, all that affects what the family receives, not what you're giving necessarily, but how the family is receiving that. That's the gap that I mentioned earlier as well. A provider, a professional can feel efficient, like I did a great job. And then the family leaves and still doesn't know what to do next. It wasn't clear. And it's not a failure. It's just we have to figure out how to close that gap. So let's take a moment and reflect. You're not a provider or professional today. You're a patient, you're a parent, you're a caregiver, you're going to a visit with someone you love or maybe like. Either way, you're in the room. So think about your best healthcare experience and think about your worst. So thinking about the best one, what was communicated? Did you feel respected and heard? What did that particular person, professional or provider, do to build your trust to where you listened, you followed through? You was like, that is the best experience I've had. So then when you think about the worst, what made it the worst? Was it their tone? Did they assume that knew something or assume that you didn't know? What was the barrier there that made it harder to where you consider that to be the worst visit you've ever had? What kept you from asking questions? Did you feel like your questions weren't answered? So these are the things as a provider or a professional that you have to think about. Sometimes you're going to be at the other end of that chair. What makes that a good or bad experience for you? What's the one small change in that worst visit that may have moved it into being an okay visit or a great visit? So that's the two things that I want everyone to think about. We do have to put ourselves in the other person's shoes. As a parent, I do that. I think about, okay, I know my provider is busy. So how can I make this an efficient visit where I feel like I got all my questions answered without turning a 20-minute visit into an hour long because I have a million questions. So when you think about back to my pediatrician story I told you a few moments ago, that's a really great example because communication isn't just information that's coming from you to the family. It's how it lands. And whether we're building trust to bring the family back, to bring me back, for me to follow through because I trust my pediatrician now. We're partners. That's the difference between the follow-up and you calling and the parent hasn't done anything. And trust shows up in little small ways. Patients engage more when they feel respected. We're having a conversation. I'm not being talked at. I feel heard. Feeling heard increases the follow through. Even if a parent leaves confused, but I know you heard me, I'll call and say, hey, can you clarify what I'm supposed to do next? What do I do with this referral? Are you going to contact me? Feeling heard means I want to talk to you. We're partners, right? I'm not a passenger. We're partners. Again, tone and body language it carries almost more weight than the words. So a small change in communication can change the entire experience of care. And that is important because a family following up on your referral could be the difference between a great healthy outcome for the family, the child, the patient, or not so great because they didn't understand why they needed it in the first place. So, what does this look like in a 15-20 minute visit? Ask open-ended questions before an answer is assumed or knowledge or understanding is assumed. So it takes 10 seconds and it will help, it'll tell the family what you actually need. Because if a provider says, do you understand? I'll say yes. Versus if you say, do you understand the benefit of this medicine? If that makes sense. Explain the why behind the recommendation, not just the what. That helps a great deal. A reason turns into instruction when it's something worth following. This is the what, and here's the why. Leave a pause for questions. And my doctor is great at this. She'll ask me a question and she'll wait instead of continuing or looking at her chart or not making eye contact. She's talking to me about my health. Where you want to choose a let's figure this out versus here's what you need to do A, B, C, X, Y, Z. And again, that kind of goes back to explaining the why. We want to know why, not just the what. So, what families remember? So, take me out of your head and think about your 2 visits, your best experience and your worst one. What you remember, what you didn't like. Did you feel heard? Did you feel respected? Did you feel like a partner in your care? Or did you leave feeling like I'm never going back, ever? So sometimes you do need to put yourself in a patient, parent, caregiver mindset. That's the best course of action when dealing with families because you're someone's family. So, some of the key takeaways because healthcare doesn't end just because the visit's over. You may, over the course of your career, you may see hundreds, thousands, plenty of patients, plenty of families, plenty of people. But the fact is, providers change throughout a parent's life, a caregiver's life, a child's life. But the parent generally doesn't. We're going to be the same. We're in it for the long haul. So I would like to have a good experience with healthcare. And it helps me as a parent make sure my kids get the care they need versus people that don't have a good experience. And things with kids could be handled earlier because I have providers that I trust across the board, across the system. Everyone's communicating great. We're partners. So every single interaction is a chance to build trust. It's also a chance to lose it. And again, we want to close that gap. So thank you all for the work you do. I know as families, we're 1 in 100 during your day, but it's those small things that make us say, gosh, my kids have a great pediatrician. She listens, she understands, or I have a great provider, or this clinic is great. And that makes for a healthy Louisiana and just greater health across the board. So thank you for letting me take a little bit of your time and share a little family parent perspective. So I'd love to open it up if anyone has any questions, comments. I have 29 years of parenting experience that I could share as well. So with that, I'll turn it back over to Julie.
Thank you so much, Valencia. I always love hearing you speak. Like Valencia said, we're open to any questions or comments. You can do that in the chat or in the Q&A. one of my favorite parts is just the reminder of thinking about the communication of, what are we going to do? How are we going to move forward versus this is what you're going to do or need to do. And that is such a powerful phrase. I even think about it with my own parenting, communication. So thank you so much for those key points. I'm going to give a couple minutes to allow for any questions or comments. We'd love to hear it. I'm also going to put the evaluation link in the chat. Remember that that needs to be completed in order to get credit for this webinar today. We have one more webinar in our series. We're going to hear from Medicaid next Wednesday at 12:30, the 29th. So we certainly encourage you to join us with that. We do have a statement. Valencia, thank you for your clarity and relatability, sharing your experience and wisdom. People are nodding and smiling. Great job and great message. So that is a comment. So guys, make sure to leave that in if you have any questions or comments. Otherwise, you can complete the evaluation, and we hope to see you back next Wednesday.